was born and raised in Bulgaria, a small country in Eastern Europe, and my grandmother was the first woman oral surgeon who graduated her university in 1950s. She inspired me early on, before being even a teenager, for the excitement we can gain in the jaw surgery arena as well as anesthesia. So I knew that I would like to dedicate my future studying and career and endeavors in my professional development to be an oral and maxillofacial surgeon. Our most important goal from standpoint of our patients is to conquer their fears. I love working with patients from many aspects. First, I love my young teenage patients because this is their first opportunity to experience surgery. Subsequently, we also love our patients that have had a difficult experience before in their life and they have phobias, and we're so happy to see that they can overcome their phobias and actually feel comfortable in this setting, and if they have to do these procedures again in the future, they are looking forward to it rather than trying to postpone it and let things get worse from standpoint of infection and pain. My goal with the patient care in our office was to continue this patient-centered philosophy where we take our time and educate each and every patient with all the treatment options, and we work with high-level practitioners in our local environment so we can deliver the best long-term successful outcome for the patient.
I love what I do. I love to work here. I love working with Dr. Dimitrov. Whenever you come, we will be so happy to take very good care of you.
Everybody here is just passionate about helping and assisting and making sure that you have the best treatment.
It's just a loving environment. I actually enjoy the dentist now when I come here. Everybody's so welcoming. I've never had a bad experience here.
Core values of our practice are to provide the highest level of ethical care in a friendly environment, like one big family.
I love what I do. I'm always going to be with a smile, and once you come into our office, I'm going to try for you to be as comfortable and welcome as possible.
What impressed me most about Dr. Dimitrov and his office was the customer service.
Everybody on the team was very knowledgeable. Step by step, they were always telling me what they were doing.
I love working with Dr. Dimitrov and our great team, and I would love to welcome you all to our practice.
One of the things that we encounter mostly in our patients post-surgically is their excitement of how easy it ends up being.
If you have any questions about anything, the staff will answer them or the doctor will answer them. Just feel very much at home here.
We're very grateful to our patients to trust their health in our hands. Since 1989, we pride ourselves to be a patient-centered surgical office where we can provide the most updated technology. Every outcome, it's based on the preoperative mindset of the patient and the continuation of this positive feeling and belief that they were going to recover quickly, even if they have pain and problems to begin with. Patient can expect an ethical, friendly environment, in-depth consultation regarding everything that is on their mind, and most likely they will discover other things that they have not thought about before that we can improve together and avoid having to do procedures on an acute base pain level. We believe that technology drives all our future endeavors as living in the 21st century, and technological advances in medicine and dentistry are extremely important when they're rigorously studied and FDA approved in order to provide the patients with minimally invasive treatment, quicker recovery, less inflammation, and more predictability. One of the best technological advances that we employ at loveyourjaws.com is using the robotic device to place the dental implants in a minimally invasive fashion with more controlled angulation and high torque on the primary stability of these implants, so they can be successfully connected to a prosthetics that same day or the day after surgery.
So Dr. Dimitrov and the robotics, he introduced me to that maybe 2 years ago when he first purchased it. I was excited because it was something that was so new, so space age, so high tech that it was, to me, something that I was looking forward to working with.
We are able to give the most updated state-of-the-art reconstruction for our patients because we are highly specialized in our educational endeavors as well as post-graduation educational, continuing education endeavors.
Without the technology, we're lost. And we didn't realize we were lost until we started adapting the technology. And so at this point, anybody who's not involved in technology, especially the digital aspect of dentistry, is actually falling behind.
I'm very grateful that we're on the edge of the technology, living in this wonderful country, United States, and we can employ these rigorously studied materials and methods to get the best outcome for our patients. Since we have the first FDA-approved robotic device for placement of dental implants, we have seen tremendously great outcomes in our patients because of the minimally invasive approach, the higher primary stability of placement of implants, and this comes along with less inflammation, no pain in our patients, even multiple implant placed, and we have a higher predictability for quicker reconstruction. We evaluate every patient one at a time. Some patients are good for the robotic assisted jaw surgery and dental implants, and as the technology is evolving, more and more patients are candidates for that, but not every single patient is a candidate for robotics. The procedure takes, if we're planning to do one dental implant with anesthesia, it takes about 1.5 hours with going to sleep and waking up and getting that dental implant placed in a perfect position in a minimally invasive approach. Recovery of dental implant surgery, it's very straightforward since we have taken our time to evaluate our patients beforehand and give them the right medications preoperatively, intraoperatively through IV intravenous route, and post-surgically in a proactive manner. The benefits for our patients are quicker time of healing to final reconstruction, and the feedbacks that we get is they did not expect that they can undergo a jaw surgical procedure and have such a quickly resolution of their symptoms, discomfort, and getting back to normal.
Well, my first visit was about a year ago, I believe, and I needed to get an implant. I actually need 3 implants, but I got 1 done already.
Miss Nancy was a previous patient of our practice since 1990s. She had a wonderful experience before with dental implant reconstruction, and unfortunately when I met her a year ago, she had fractured her front tooth.
What has impressed me most about the office is the staff, the doctor, the professionalism. However, they're also very lighthearted and fun, so I come in here almost feeling like I'm with my friends, which is the best way to be.
So for Miss Nancy, we were able to provide dental implant placement with the robotic assistance. We were able to have her reconstruct her front tooth in about 2 months instead of the usual 4 to 6 months of waiting time.
What I'd have to say to the team is just thank you for everybody doing such a great job. When I had my surgery, the doctor explained everything as he was going through the procedure, which always makes you feel good.
Miss Nancy reported to me that she had no pain, no swelling, and no discomfort after the dental implant surgery.
I think the best way to explain how much I like this doctor and the staff is that I drive round trip 5.5 hours to get here. That's how good I think they are here.
Wisdom teeth are the very last set of molars that we have in our jaws. At this stage of human evolution, we don't have enough space at the back of our jaws to allow for the wisdom teeth to come in a proper position for function and to keep them clean. We start having infection, pain, and also destruction of our healthy second molar teeth, which we would like to keep for the rest of our lives. And it's very important to be proactive on the removal of wisdom teeth, so we don't allow them to develop long roots and increase the chance of nerve damage after surgery, do them later in life where we're not as healthy as we are when we're younger, and the recovery can be compromised just because of the health status of the patient. We employ a special technique of minimally invasive approach to remove the wisdom teeth. The treatment process for a wisdom tooth extraction is first a cone beam CT scan, and we mark out the location of the sensory nerves, which could be very often in proximity with the roots of the wisdom teeth, their sinuses, and from that standpoint we're able to deem the patient in different risk categories from standpoint of injury to their nerve or problems with their sinuses. The recovery process for our wisdom teeth patients is very straightforward because we employ a special preoperative medication, intraoperative medication, and postoperative medication proactive regimen, as well as very gentle and minimally invasive surgery. Steven was one of these patients who actually was avoiding the thought of going to get surgery for his impacted wisdom teeth for quite so many years.
So when I had my wisdom teeth, I was always in a lot of pain, especially when I was eating.
Or he came here with anxiety and pain and uncertainty about how to take forward the next step towards the surgical procedure.
What made me choose this clinic was that the doctor was always, friendly. He was very transparent with his work, and he made me feel comfortable.
The recovery for Steven was very straightforward and quick, and he enjoyed the anesthesia part so much that when I asked him at his first post-operative appointment if he would like to do this again, he said yes, absolutely.
I was always scared to go to the dentist, and they made the experience extremely, good. 10 out of 10 for the team.